guys, welcome back to this brand new episode. I'm so excited for this episode because for many reasons, which I'll tell you later. But right now, I have to introduce my guests first. On my left is someone that you guys already know. She's been here for our love language episode. We've got Carice out.
Exactly last year,
Oh my God. Yeah. And you were not even pregnant yet. Look at you
wasn't.
now, glowing, mama.
It's the sweat.
She keeps saying it's a sweat, but I'm so sure it's a pregnancy glow. But anyway, on my right, we have Dr. Navdeep Singh, who's also a medical doctor, consultant, and OBGYN, and also a fertility expert at TMC Fertility. Am I right?
Yes.
Did I get it right? OBGYN.
Yes, you got it absolutely correct.
Yeah. So it stands for obstetrician and gynecologist.
Yes, you're right.
That's right. Hi, Dr. Navdeep.
Hi. Hello.
How are you doing?
I'm good. Nice.
Yeah?
Thank you very much for having me on the show.
No, I'm excited. We are excited
Very
to have you
excited.
on the show. Of course, today we are going to talk about a conversation that not a lot of people have. I guess fertility and infertility. And I know a lot of people are like, I'm not planning for a family anytime soon. So I don't think I need to have this conversation. I don't have a partner yet, or I'm not even thinking about having a baby yet. But I think that's why we should be having this conversation right now, because so many of us think that way. Correct me if I'm wrong. Like, I just turned 30, not planning for a baby anytime soon. But I honestly don't know if I'm fertile or not, or what does it take to have a baby? It's not just the action.
No.
But
100% no.
so of course I can't speak for on behalf of everyone else. That's why I got the both of you here who are expert in the field. Of course, Dr. Navdeep and Carice, who has been through quite a bit to be where you are today.
Yes.
I'm so happy for you, really.
Thank you so much.
So let's get started, you guys. Okay, maybe Dr. Navdeep's first. This is your first time here on Head Over Heels.
Yes, it is.
How are you feeling right now?
Good. Very relaxed.
Oh, I love it because I know you're very used to more formal interviews,
Yes,
right?
correct,
So
yes.
yeah, we're very chill, okay? Okay, so tell us, how long have you been doing this, and like what made you, specialize in this field in particular?
Well, I've been doing fertility work with TMC Fertility the last 12 years.
Wow.
And reasons why I joined this line is because it's quite a satisfying job. You see, when you treat the patient and eventually you help them, get their baby of their dreams. So the feeling of accomplishing something, getting things right and making someone happy.
Yes.
Okay, so that's something which I found very, very satisfying. So hence I decided to embark into this specialty called fertility.
Right. So of course we are talking about fertility. So we're going to jump right into it, okay? So beyond fertility, beyond getting pregnant, do you think it's important to get yourself checked? Because a lot of people actually don't even think about getting themselves checked for their fertility or their fertile level? Fertility,
Yeah.
right? Like, I have not actually thought about it. Like you said, it's not just the action. So how important it is for people to get themselves checked?
Well, I think number one, it's important for you to know about your own body yourself. Okay, it's not only for fertility in particular, but going for general blood tests or medical checkups on a yearly basis, I think is important.
Yeah.
Because when you do that, I'm sure you'll find out that you have a certain type of problem, which if it worsens, then may lead to a problem in your fertility, right? And tests, for example, that at an early age, if you find that you have issues, for example, for women, you have irregular cycles or, excessive hair growth, then you have a hormonal problem. So those are the times when, you should see a doctor to get it checked.
What would you say to people who are scared? Because I know the common consensus amongst people, at least the people in my community, I'm too scared to get checked. I'd rather not know.
But they're very shy somehow.
Yeah.
Yeah, you do have a group of people like that, but I believe that knowledge is power. So if you know,
Correct.
but that you are well and you're healthy, and that's very reassuring. It boosts your confidence, and if you suddenly realize that you have a certain issue, then that's a time when you can get it treated before it becomes a big problem. I always advise people, don't chase your problem. Find it out first before it becomes a big issue. Because lots of illnesses, you can detect it early before it becomes an issue.
That's true. Like and also once you know early, at least you have alternative and options. Sometimes when it's really at a much later stage, options become much more scarce.
It
Am I
helps your
right?
decision also, how you move forward
Correct.
after the
yes.
test and everything.
Yes,
Yeah.
because when you detect things earlier, then there's a wide array of kind of options that doctors can give you. And you don't like one option, then you can get a second opinion, you know. So when it's late, then you don't have that leeway, you see.
Okay. Yeah, so to those of you who are still like contemplating whether or not you should get yourself checked for just a general health reason, I hope this is the nudge for you to go do so, because really knowledge is power. I think that's something that I've been talking about over and over and over again in everything that I say. But in terms of fertility, right, do you think it's important or necessary for people who are not planning for a family anytime soon to do it? And if yes, at what age is the most appropriate time?
Well, regarding fertility per se, they do not need to do an invasive test. Simple tests, for example, for women, ultrasound scan to check the womb and ovaries, or blood test to check the hormonal profile will be sufficient.
Right. Okay.
And generally, when you see a doctor that asks you lots of questions about, you know, your whole menstrual cycle and your general health, then they will be able to tell you what are the issues that you have. Okay, and but once you have got married and you've been trying for more than 6 months to a year, still unable to conceive, then that's the time you need to do more invasive tests. For example, the X-rays and, you know, the other things. As for guys, if you see, for men, they can still do the general assessment which you mentioned earlier.
Yeah.
And if they really want to know how their sperm count is, then you can easily, you know, send your specimen to the lab for assessment rather than throwing it down the drain.
For the
You know,
analysis.
so in that ways, then they'll know basically where they stand.
Yep.
You know,
Right.
if they really want to do it.
So you mentioned, I caught something that you said, if they've been trying from 6 months to a year and still not able to get pregnant, so that is a sign of a possible infertility issue? Would
Correct.
you say so?
Yes.
Carice, may I ask you your story? Do you mind telling us your story actually, since, yeah, I'm very curious.
So for me, we started trying in 2021. But for us, at the beginning, we got pregnant fast.
Yeah.
Like within 3 months, which is a good timeline for us. But right after that, I had a miscarriage. And then it took another, I think, half a year to get pregnant again. And then I had my second miscarriage. And then it took, I think, another half a year to get pregnant. So about, I think 6 months is when you should already try and get tested. That's what I did actually. I actually went to a fertility center, got my blood test, and I found out that my eggs are less than the women my age, the average age.
Oh, on a lower count.
On a lower count. So
Okay.
that helps me like decide. So after this one, I immediately I'm gonna try for my next one because age is a factor.
Right.
Yeah. So going and getting tested is like one of the best decisions. So I can make decisions.
Yeah. Okay, if you don't mind me asking, doctor, actually, like, what are miscarriages like that in early stages common? And if yes, actually, why do they happen?
Okay, it's multifactorial. You know, the commonest cause of miscarriage is unexplained. Unfortunately.
That's what all the guys tell me as well.
But,
Yes.
but the
Unexplained,
identified cause, common one would be genetic abnormality.
Yes.
Okay, so when you look at all pregnancies, 15% of all pregnancies generally may end up with a miscarriage, okay, or a problem. Okay, and as you get older and older, the percentage tends to increase.
Right.
Hence, that's the reason why we always advise young couples to quickly get pregnant, get your children, complete your family as fast as you can. So that's why, the elders in the family always say that.
Yeah.
That's one reason. And yes, I agree. It's frustrating at times. Even we do not know the reason why.
Correct.
Yeah.
So when you have a miscarriage after the first or second, generally a lot of doctors tend to do a lot of tests on the patients.
Yeah.
Because we too want to find out why did they miscarriage and miscarry and many times the advice would be more like nutrition, lifestyle,
Yep.
and try again. Okay, so it's generally a timeline. So after 6 months of trying, unable to conceive, then they do lots of tests. And then I generally ask my patients, to try naturally, probably 2 or 3 months. If you're unable to, then we start
Nudging a bit.
Nudging a bit, doing other things. For example, other fertility treatment options, you start using them.
Right. So it is very common and it is commonly unexplainable.
Yes,
But
you're
people
right.
just don't discuss it.
Yes.
Curious, do you mind me asking you, like, how was it like for you? If you could share with us how it made you feel, like, what in terms of, I think you guys were struggling
Yeah.
silently because not a lot of people knew at the
Yeah.
time.
So the first time, I think it was very shocking because I think we were not educated on how to deal with a miscarriage. In bio, we will always know the sperm will meet the egg and in 9 months the baby will come out. So for me, it's like, it didn't happen for me. So we asked around, found out so many friends actually had miscarriages, but they kept it down low. And then we had to ask Dr. Google, ask other doctors, what can we do?
Yeah.
How do we get over this? And for us, I think mostly it was the emotional health
Yeah.
that we struggled with because there weren't a lot of support, like information out
Understand.
there.
Yeah.
So that was a bit difficult lah. So the second time happened, we were more frustrated. I think
Right.
we were at that like, why is it happening like consecutively? But then we also felt it wasn't our first rodeo. So I think right after the second one, we were more like intentional.
Yeah.
Like when we were trying.
Yeah.
And we were more realistic as well. So when we found out about this third pregnancy.
Congratulations.
Thank you so much. Thank you so much. It was more, the miscarriages kind of took the wonders of
In the beginning.
getting pregnant. Yeah. So when we found out, it was more like, here we go again. Instead of like, we're pregnant again.
Yeah.
So after that, I think we had a good gynae who helped us.
Yeah.
I think I had bleeding problems. We found out we had internal bleeding. So that is like a hormonal problem, progesterone.
Correct.
So we found out about that. So the doctor quickly gave me progesterone shots to stabilize the pregnancy. And I think that really helped. Having like doctors like you who are very proactive and know what they're doing.
Yeah, I think that's good. And also the kind of conversations that you guys have. Some doctors are like, it's okay, you'll be okay. You'll be fine. Go home. You'll be fine.
Correct.
Yeah, I've never been pregnant, but like sometimes going to some doctors who don't have the heart.
The empathy.
The empathy. Very hard leh. But yeah, actually doctor, so after hearing your story, then only I started kind of like following what you've been sharing as well. And you shared like a lot of your followers as well went through what you did.
Yes.
And a lot of them are in fact still trying.
Yes.
And there was one time you mentioned some of them went through how many miscarriages?
9.
Yeah.
Wow.
I can't imagine the amount of, it's tiring.
It's very
mentally,
tiring.
especially.
But
So
physically as well.
yeah.
Yeah.
So, and there's this stigma around, when you're infertile, you're not good enough, you cannot have a baby and all that stuff. What do you have to say about that, doctor?
Well, number one, I think women are very strong.
Thank you.
Okay?
Thank you.
So, so you can see that the example here, she had 2 miscarriages and she had energy to go on the 3rd pregnancy, and that's good, and to continue fighting out, until you get your dreams. Okay, that's very good. Congratulations.
Thank you.
Okay, and so generally a lot of women come into the clinic, and they're very open about their problems in terms of what issues that they face every day. And I think it's from our side as doctors, we should be, the medical fraternity should be more open with information and not have the kind of paternalistic kind of approach to the patient. You can't do this, you can't do that, And so everybody's journey is different.
Yeah.
So we have to tailor make the treatment, or rather the discussion according to the patient's needs. So that's important. Secondly is that men, the husband has to support the wife and the whole journey.
Yes.
Okay, and that's very, very important in my opinion, And but good to know that over the years, I've been seeing lots of men, lots of husbands, they come in together with their wives.
Was it not the case before?
A long time ago, I guess the education or the awareness was not there, that everybody felt it was a woman's problem.
Like your woman's job,
Yeah,
right?
it's a woman's job, to get pregnant, and you're not pregnant means that means it's a woman's fault.
Yeah.
Okay, that was how it was long time ago. But good to know that now it's not.
Yeah.
That 30% of problems is due to women, 30% men, 30% both. So basically, it's 50-50.
50-50. Yep.
Okay, so when patients come and see me, I insist that both must come in together and both must be checked.
Yes.
Okay, it's not like the wife checked alone, the husband said, no, it's not my problem, it's my
Yeah.
wife's. No, it's not like that. They both have to do it because you'll be really surprised that the statistics is actually correct, 50%.
Oh, really?
Yes.
Yeah,
it is.
because that's my next question. Because a lot of times when we talk about couples struggling to conceive, most of the pressure is being put on the women. Like, hey, why is she still not pregnant? But the question is not really directed to the men most of the time. There is, but much smaller percentage, right? In terms of like our daily conversations.
Yeah.
So, so it's not true that infertility it's largely a woman's issue then. It's 50-50. Is there any distinction that's who's more prone to it, or is really straight up 50-50?
Well, generally the diagnosis or the problems, they're more in women.
Right.
Okay, because you have a womb, you've got ovaries, and you've got other issues, blood issues, things like that. Men generally is about about their instruments. Okay.
Yes,
about
the soldiers.
whether they can perform or not,
Yeah.
whether they got enough sperms.
Yeah.
Okay. However, you must note that if the man has very poor sperm quality, then he has to go through a lot of procedures, injections, and medications just to help them improve their hormonal profile and produce good quality sperms.
I'm very curious, right? Nowadays, there's this thing called egg freezing.
Yes.
Oh, yeah.
Can you walk us through how that's like? Because I don't know, I just have this thought at the back of my head that I might want to do it. Because I really don't know when I will be pregnant or I plan to have baby. And I want my, not sperm, sorry, I don't have sperm. My eggs to be as healthy as optimum for me to do so. Yeah, do you mind walking us through like what it's
Can.
like?
Generally, the plus points of freezing your eggs is that in the back of your mind, you have the option of having your own biological child.
Yeah.
Okay, because as you know, as women gets older and older, the number of eggs start to reduce, and the quality too reduces. So after the age of 40, then the probability of having a healthy child tends to be reduced and increased risk of miscarriages. Okay. So when you freeze your eggs at the early age, you tend to get a larger group of eggs that can be used in future.
Yeah.
And they are young. Okay, according to your age now. Okay. So generally it includes the treatment is basically come and see a doctor, we do an ultrasound scan, some blood tests to ascertain whether you're healthy and to see whether there's anything to modify or not in terms of hormonal medication. And then we start off the injections.
That's the painful part, isn't it?
Yeah, the injections are very, very fine and small. Okay, so everyone has the impression that injections are the big ones which you have to take your blood. No, they're very small, fine needles.
But you still have to
You have to
Correct,
do it
yeah.
yourself, right?
You can do it yourself or get your partner to do it for you or go and see a nurse. Or even, your parents are living with you, you can get them to do it for you.
Yeah.
Okay? And then we generally we give the injections for about 10 days.
Right.
Okay? And then we will do an ultrasound scan to have a look at whether or not the eggs have enlarged. And then we give you some anesthesia, okay, put you to sleep, and then we retrieve the eggs. And those eggs are frozen for you. Frozen till eternity. Until how long until you have found your Mr. Right.
Yeah.
Okay. And then you can use them.
Eternity, forever.
Forever, yes. They're stored in nitrogen tanks. Yeah.
Wow. Okay.
Okay.
But must be expensive. How much is it?
Generally, the
range.
cost can vary to about average about 15,000
Okay.
ringgit, where the whole process of taking the eggs out, seeing the doctor, the embryology lab, and your medication.
How per time? How many eggs can I freeze?
Depends. Depends on age group. So
My age group?
the largest amount, the most amount of eggs I've taken out is about 40 to 50 for one
that's a lot.
patient.
Not bad.
Okay.
But is that a lot?
Yeah, that's a lot. man.
Okay.
It's dangerous too at times. There's ovarian hyperstimulation. But some patients just respond a lot of, aggressively and excessively. And I've even taken one from a patient in an older age group. So that's not very good. So we want more the merrier.
Yes, the more the merrier. Okay. Yeah, that's something that actually I've been thinking about because I know, I think in Singapore, I don't know, is it illegal or is
They have rules. They have certain rules and regulations that they follow.
Right, okay. So it's not as easy as it seems that you want to freeze your egg, then you can freeze your eggs, right? Cool. So that's one of the ways for you to
Preserve your fertility.
preserve fertility. Okay. I want to know more about infertility because really it's not a conversation that a lot of people have. Only until someone experience and go through it, which is sadly sometimes, a bit too late. So you want to know before it happens. What exactly is infertility?
Okay, infertility is an issue where a couple has been they've been having unprotected intercourse for more than 12 months and unable to conceive. Generally, if you are above age of 35, then we take it at 6 months.
Oh.
Okay, so by, every month trying and still unable to conceive, then there is definitely a problem somewhere. Okay?
Could it be stress sometimes?
Well, generally in stress, women don't ovulate. They have an ovulatory cycle. And in men, when they are stressed, then they just can't get an erection.
Yes.
Okay, then there's no sex at all, you see? So, yes, definitely stress. So I always tell my patients to please compartmentalize your stress. Leave work at work, home is different.
It's the lifestyle as well.
Lifestyle, yes.
Being in a city is like a stressful environment.
Actually, you share how.
Very,
I mean, I'm so happy that we have BBB coming along.
Triple B.
Triple B. Still don't know what it stands for, but beautiful baby. Oh, beautiful baby boy.
No,
Girl.
don't know yet.
Oh, don't know yet. Okay. I'm
Next
just
month
assuming.
we will find
okay,
out.
we'll find out gender reveal after this episode. Anyway,
For us.
for you guys, I know it's a bit TMI, but we don't have to go into details. But was it hard to try for a baby?
try.
I don't know. I've never tried for a
us,
baby.
I think because we were very intentional. We want the baby to still be made out of love, out of passion.
good.
So we did the works. We turned down the lights, scented candles. That's the secret.
All right, BBB, if you're listening to this.
Sexy music, things like that.
So
I mean, it helps because you would get in the mood faster as well. So sometimes I know it's very stressful to have
it feels
timed
like a
sex.
chore.
Yeah,
right?
it feels like
okay,
a
I'm
chore.
ovulating right now.
Correct. But I think if you really want the results, you have to do all these things. Like I actually used what do you call that? Ovulation test kits. And I track my period when I'm ovulating. I count the days. So you don't question. Because I do have followers saying like, Carice, I've been trying for 1 year and I'm not getting pregnant. I have sex once every month. Exactly, Dr. Navdeep. I was like,
that's not enough?
No!
Not enough at all.
Okay, what's the frequency are we talking about then?
Okay.
So I need to know the frequency, One day I need to try also.
Yes. Alternate days, Maggie.
very tiring,
Alternate days.
No, having sex is tiring. But, so how many times a week?
First of all, sex shouldn't be homework. Okay? So I had
Should be
patients
having
calling
fun.
the husband, come back right now. I'm only thing is to patah balik from work and come back home. Okay? So that's the way. It shouldn't be homework. So I generally give our patients, tell them to 2 or 3 times a week. It's more than enough.
Wow.
2 kali cukup lah. 2 or 3 times a week. Okay?
Did you see her face?
No, because my schedule right now is very busy. So, okay, understand. Next time I want to have baby, cannot work.
Okay, 2 or 3 times a week. Or you can increase the frequency, okay, when you are around the fertile time.
Yes.
So actually fertile time is right after period, is it? Or before?
You have to
Generally, we have a
count,
28-day cycle.
Yeah.
It's about the 10th to the 20th day of your cycle. Oh. Okay, so you don't have to do it every day, alternate day, once in 3 days. Good enough.
But 2 to 3 times a week, that's like times 4. Wow.
See, now what you're doing is you're thinking doing homework. Okay, it's not homework.
So cannot be homework.
So probably you need to learn from her to get a scented candle.
Just that week, just that golden week, I call it.
Oh my god. Okay. No wonder they say. But you know, it's funny because people who don't want babies often just terkena even though it's one time.
Well, that everybody's fertility journey is different.
Yeah, so I think it's funny. You know the shotgun stories?
Yes.
They had sex maybe one time or one night stand. I mean, these are from movies lah. I don't know how true.
Maybe the
really
sperm very
pregnant.
strong lives
Movie.
in there.
I'm currently watching Dr. Ha.
I see.
I don't know if you guys are watching it, but basically he has a love child from that one time when he was in in university, but like one time. But it's possible too, right? To just hit the jackpot.
Yep, possible.
Wow.
They say 1 egg and 1 sperm. That's it.
Damn. Okay. Sorry, I just needed to know, I'm not trying for a baby, but I'm very curious like what it's like. So now you guys know average 10 times a month.
I mean,
Sorry, I'm still calculating. Sorry, I'm a strategy kind of gal, I need to know like the strategy. Anything else
the
you want
more,
to share?
the better, right?
Yeah. I mean, it's
sex
fun. It's
supposed
fun.
to be enjoyable.
Yeah, it's fun. It's fun. Okay, I have another question, doctor. Can you get pregnant if you have sex during period?
Well, a lot of people, certain studies or certain articles have mentioned, yes, you can. However, the probability is very low. It's extremely low because after a menstrual cycle, then the blood is still there. Then probably the sperms will get drowned inside there somewhere.
How about sex when you're breastfeeding?
Well,
Do you really get pregnant?
when you're breastfeeding, you have a certain hormone in your body known as prolactin, which is elevated. Generally, you don't ovulate. So that's why a lot of women, when they are exclusively breastfeeding, they don't have menses for 1 year at times. Okay, but of course, you do have those women who still get pregnant during breastfeeding time.
Right.
Those women are generally probably not exclusively breastfeeding and mixed feeding and things like that.
I see.
Okay, I never knew after. Sorry, this is a perspective from someone who's not pregnant lah. After you give birth, you don't. You have period for a long period of time. Is that correct?
Well, it's generally known as lochia. It's your
what is
inner
that?
lining of the womb shedding and all the other tissues coming out. Yeah.
Right. So during that time, can you have sex?
Well,
Sorry,
generally, no one has asked me that question. Really? Okay. So, so generally, that's a time when in Malaysia we call it pantang. When they're not supposed to
confinement.
confinement. Yes, that's the word.
I don't think you can lah.
So I don't think
I'm just
I don't think
curious.
the woman will want to at that time
Yeah,
too.
you just push something out, put something back in.
Yeah. So basically, I guess if they are too willing, the
maybe
partners
I
are
see
willing.
sex. Yeah.
Then I guess I don't see a reason why not to. Okay, but generally speaking, they don't really be tired after delivery. And
Yeah. Of course. Sorry, I'm just really curious. I sound like a sex maniac right now. But no, I'm just like
it's okay.
technically curious. Okay, we're gonna get back to being pregnant and all that in a bit. But when they say some people get pregnant back to back. I don't want to say is it healthy or not healthy, but is it recommended? Because you need time to recover. So some people really within a year they're pregnant again. Yeah.
Well, generally it's not recommended. They call it poor spacing.
Right.
Okay. The reason why we advise them not to do so is because when you deliver your baby, okay, you have lost lots of your nutrients, your blood, and you're tired. Okay, and you're just getting used to having a baby. Baby's breastfeeding. Okay, so getting pregnant immediately after that, within a year or so, may be a bit taxing to the woman's health.
Right.
Okay,
So it's not
and they're not recommended because you're still taking care of a small baby. Now you take another one, so you're like having twins.
Yes.
That's true.
It's too close.
Too close. Yeah.
Maybe
A
2 years.
2 years.
What's the recommended gap then?
Generally,
2 to 3?
1.5 years, maybe 2 years. 2 years is fine.
Okay, 2 years is a good time. Okay, you can take note. I'm taking note. Yeah, yes, taking
2
note.
years.
Yeah.
I'm on it.
All right, what's the date today? We're gonna mark it down. Actually, when are you due?
I'm due end of August actually.
Oh,
So
Merdeka
approaching-
baby. Possibly around
that's
that
the
speed.
max. Like
Oh,
40
max.
weeks is the max,
pretty
like
Right.
28th of
Okay.
August. But I hear stories that it will usually come out earlier.
Mm.
So maybe mid-August. I don't know. Depends on how comfortable it is.
Yes. Oh, I remember my question already. Yes. So it's about, I mean, you're a gynae. How many babies have you delivered in your career actually?
Well, I
Do
really
you
don't
count?
know. No,
You
I
don't
really
count?
know. From the
I know it's-
government service till now, I think probably a couple of hundreds,
Hundreds? That's a
maybe
lot
more
of
than
it.
that. Yeah.
Okay.
Yeah.
Because they say, I recently also just realized because a lot of my friends are getting pregnant. So I'm getting a lot of different stories and I'm like kind of just really curious. Once if your first C-sec, the following pregnancy, you cannot give natural birth anymore. Is that correct? Or
Not true at all. After a cesarean section is done, should always be done for a reason. Okay, either baby is having issues, or mother just can't deliver the baby out. Okay, for some reason. So when you have first cesarean section, the second pregnancy you can still try for a vaginal birth.
right. So
Okay.
it's not true.
Not
It's
true.
a myth.
But after 2 cesarean sections, the third one must be a cesarean section because then there's a risk of scar rupture. So we do not want the cesarean section scar to break open because then it can be dangerous to both the baby and mother.
In terms of process, which one is more complicated?
Well, I think both methods.
Yeah.
They have their risk and benefits. Okay, as I mentioned, you must have a reason why you want to do a certain procedure. Okay, so now, generally speaking, vaginal birth is more natural.
Yeah.
Okay, all of us have been, for humans, thousands of years have been delivering normally. Okay, so I would always advise my patients to try to deliver naturally first. And if it has a problem, then opt for cesarean section. So I won't advise them to do a Caesar straight away.
Right.
For some reason.
And
some social
recovery is
reason.
much longer too.
Well,
Or-
all depends on patient to patient. Generally, yes, cesarean section recovery can be longer. Okay, but all depends on the patient's body. I got some patients after the cesarean section, 1 week later she's walking around like nothing happened. I got another patient after a vaginal birth and she's still having a lot of pain, a lot of issues. Okay, so all depends on patients
Right. Okay.
and your doctor who gives the medications and all.
Yeah. Yeah. Thanks for sharing, doctor. Like I'm curious about so many things, but I think I want to go back to, being infertile. Actually, are there any physical symptoms that they can look out for apart from obviously trying for 1 year and still not that you are infertile?
Generally for women.
Yeah.
Okay, if they were to have an irregular cycle that don't have menses for like 3 months, 6 months, now that's a very clear problem that you have.
Okay.
You're not ovulating.
Yeah.
Secondly, excessive hair growth.
Excessive hair growth.
Yes, something like
hormonal problem.
hormonal issue known as polycystic ovarian syndrome.
Yeah,
Okay, where they have increase in hair growth, male hormones, and those things also. And you have a painful menstruation, severe pain, or even you feel a lump or kind of swelling in your tummy.
Like
that may be an
cysts.
ovarian cyst. Okay,
Oh, yeah, I
which
had
need
that.
to be operated or treated. Okay, and other patients, like for men, for example, if you don't get an erection, okay,
Yeah.
and or you have or the man is having things called like premature ejaculation before even starting intercourse, and that's it, everything's out. All right.
Yeah.
So that's a problem too.
Yeah.
Okay. And or they have swelling or pain in the testes. So all these things should be checked. You don't have to wait for 6 months or 1 year. So
Yeah.
if you have a problem, okay, go and get it checked.
Like if you feel something is just not right, right?
Correct.
Just listen to your body a lot
Correct.
of times, right?
Yes.
Feels like I feel like I believe in that. I'm very instinctive with my body when I feel something is off. Because I actually had ovarian cyst and it ruptured and it caused so much pain. It's very traumatic. So my doctor did tell me that I'm very prone to having cysts. Could it be genetics?
Not genetics. Some women tend to have, all women have cysts. Okay, something called a corpus luteal cyst, where you ovulate every month, and that cyst will disappear eventually when you have your menses. Okay, so not all cysts needs surgery. So a lot of times we just give medication to the patient and review them, rescan them at the later date. Okay. However, certain cysts like endometriotic cysts, which are generally painful if they are large, yes, of course, need to do a surgery and remove it. Because we are worried about cysts which can undergo torsion or rupture like what you had. Okay. And those issues then be very painful. Okay. So if we see a huge cyst, we generally advise removal.
And
if necessary.
If necessary. And the cyst can definitely affect your fertility lah.
Correct.
100%.
I wouldn't say 100%. Yes, of course, it can affect your well-being and fertility in general.
Okay. Thanks for sharing. And my next question actually is can infertility be prevented?
Well, number one, if you detect the problem early, like we mentioned earlier, you go in for a general assessment, go and check, get yourself checked, and then you'll find that, oops, you have an issue, and a doctor can treat it early. Okay? And certain things like lifestyle changes, obesity, smoking, vaping, all these things, and unhealthy diet, like all these fast foods and all.
Yeah.
Okay. Once in a while, it's fine, but in moderation, this kind of food is okay. But things like smoking, a lot of people feel that vaping is a healthier option, okay? Or it's not. They're all chemicals in your body and making your body unhealthy.
How about drinking as well? Alcohol?
Excessive alcohol, yes, is a big problem. But drinking in moderation, it's fine.
Okay.
Okay? Not binge drinking every day. Binge will be a problem to your liver, and then you have a lot of issues, medical issues then.
Yeah. I think your advice is also kind of like a very general advice, like if you want to take care of your body, don't do these things to your body. Right? Don't drink, don't smoke, and don't eat too much junk food but a lot of people still do it lah.
Correct. Yeah. It's an option. You have to take a conscious decision.
Yeah.
Well, I'm going to be healthy now.
Yeah.
Not only on the 1st of January. Everybody 1st of January.
All the gym sign-ups are like,
yeah, it's true. Because I own a gym as well. Okay. Wow, January, everybody come. Okay, March, where's everyone? I don't know.
Yeah.
Then they come back after a while. It's like up and down, but that's
education.
Yes.
Education and awareness that healthy lifestyle is the way to go.
Yeah. Okay. So infertility, technically speaking, can be prevented if found out earlier.
Correct.
At least you can have treatment plans, options, alternatives. But then, we are Asians. Sometimes we are very superstitious. Our parents sometimes can like to offer some more holistic approaches and home remedies from eating maca royal jelly to like eating the placenta from someone who has given birth so that you can... I don't know, doctor, what's your take on that?
Well, generally they feel that placenta has lots of nutrients.
Yeah.
So certain companies do make pills and some supplements with it. Well, I'm not convinced. Okay. So, I'm not convinced that it works. But however, they claim it does. So, regarding the other things like holistic approach.
What jelly?
Eating,
jelly.
I don't know. It's in the notes. Like eating royal jelly, eating maca, like all this.
Well, generally all those things are healthy diets. Okay. Part of your healthy diet, antioxidants, vitamins. Okay, yes, probably it works in that way, but not only if you take maca jelly, all these things you will definitely be healthy. Not really. It's a more it's there are a lot of things that you can do to make yourself healthy. Not only do that.
Yeah.
Like supplements as well, right? Like preparing your body before trying for a baby as well.
I believe supplements are important, like multivitamins in general.
Yeah.
For example, when you're planning for a pregnancy, folic acid, vitamin D, okay? And, for husbands, like things like zinc, all these things are very important. Okay, and you can pop in a tablet or two, and that's fine.
Yeah,
like some patients will bring me a big bag of supplements. At times it's a lot.
So sometimes simple is better, huh, doctor?
Yes, keep it simple.
Yeah.
Okay, when you keep things simple, it's easy for you to follow through, to continue.
Correct.
When
More
you make
sustainable
things more sustainable. Yeah.
Okay. Okay. I want to talk about some pregnancy taboos.
Ooh.
Have you had any? I mean, I'm not pregnant, so I wouldn't know much. But we were talking about this earlier. That you said, if we used to believe that if you're pregnant, you cannot dye your hair.
Yeah.
Doctor,
Yes.
yes or no?
No.
You heard it, people.
I got a lot of patients who come into my clinic and say, Doctor, I'm not allowed to dye my hair, and I'm unhappy how I look like. And I'm like, why do you do that? Oh, I was told not to dye my hair because
Chemicals,
hairstylist
is it?
and the family says you cannot because chemicals.
Chemicals.
You use black dye, the baby might come out a bit darker. I'm like, oh God, I think I slept through that chapter in medical school. So yes, no, these chemicals are all safe for human use.
Yep.
Right.
Yep.
And the baby is
See.
human.
Human. So it's okay.
Yes, it's fine. You can dye your hair. You can go for manicure, pedicure.
I was just gonna ask that because someone actually told me like I wasn't supposed to do my
you don't
nails.
have? Oh, you
I
have?
do, I do.
Okay.
So it's
So
actually
yes, you
safe.
can.
Yeah.
It's safe.
Okay. Then is there anything that pregnant women shouldn't do? during
Smoking.
Okay, that one of course don't smoke lah.
Oh,
Actually, I have a friend that she didn't know she was pregnant, and at the time she was maybe already a few months. She's been drinking, and will it affect the baby? Because sometimes you don't know you're pregnant until you know. Right?
Correct. Excessive drinking
Yeah.
will affect the baby.
Okay.
If you drink in a prolonged period of time, like the entire pregnancy, and a lot like binge drinking. However, drinking a cup or two of wine a week will not affect your pregnancy at all.
During pregnancy,
Yes.
so you can.
You can.
Yes, you
Like
can.
one cup, one glass of wine,
So-
one cheeky glass.
Yes.
Why am I so happy? I don't even drink.
I guess she knows
So-
what she's gonna do after when she
So-
gets pregnant.
Oh,
So you see, basically, being pregnant is not a punishment. Okay,
yeah.
so
Feels
you
like
can
that.
do a lot of things,
Yeah.
but whatever you do, you have to make it. You have to do it not excessively.
Moderation.
Moderation is fine.
what about coffee?
Okay, coffee, yes, you can.
Yes. One glass a day for me.
You can drink one. The reason why we advise them not to drink too much of coffee is because some patients will get gastritis, increased bowel movements, abdominal pain, and
heart palpitations.
being agitated and anxious, heart palpitations, as I mentioned. So we don't want all that to happen. So 1 cup a day will not harm anyone.
How about salad? Because my mother
Serious?
told me not to eat salad, like
What?
cold vegetable. It has to be fully cooked,
So
according
yes,
to her.
the
Raw
idea,
food lah.
the idea is basically raw food, especially raw meat.
Like
Okay.
sushi.
Yeah, probably things were not very well done. Okay, so what you are afraid of is infection. Okay, because bacterial infection, you don't want diarrhea and it's all fever, all sorts of things. Okay, so then you'll be very unwell. So you don't want that to happen. So about salads are very, very healthy. They're laden with antioxidants. I do recommend you take it, but it has to be cleaned and washed properly.
Yep.
That's about
Prepared
it.
properly. Yep.
So go ahead and have your salad.
See, ma? I told you.
Yeah, I think like all these like don'ts while pregnant, I think I've heard it over and over again. I do see my friends also practicing it, but I guess I'm gonna be the rebellious one when I'm pregnant. Lah. It's okay. Should be okay. One.
Well,
Doctor,
I would
I'll come
suggest,
find you lah if
take,
I'm
take the
pregnant.
doctor's advice.
Yes, I always do. So
Just
I
listen
think
to
already before I'm pregnant. So
Taking down notes already.
taking down notes. Okay, I think we've covered quite a bit from what infertility is to when you finally do get pregnant, some of the taboos that we covered. But I do want to know though, for people who are still struggling right now, and still is trying, what are some of the options and treatments that they can go for?
Well, first of all, the treatment has to be personalized depending on what the patient has, what problem she presents with, what the couple presents with. So it can be from just advice on the fertile timing.
Right.
Okay. It can be advice in terms of supplements and being healthy.
Okay.
Okay. And to certain types of hormonal manipulation where we give them tablets to grow their eggs and tell them when the best time is. When the best time is. And the other things would be, if it still fails, then injections. Okay. Injections to help them ovulate or to grow their eggs. Okay. And if all those natural methods still fail, then it's like more lab work like intrauterine insemination, also known as IUI, where we concentrate the husband's sperms and inject it directly into the womb. So basically give the sperms a helping hand to go in.
Yeah.
Okay. And secondly, the other one would be IVF, the test tube babies. Okay. Those are the most, invasive type procedures where you take injections and create your babies in the lab.
Right.
Okay.
Can you choose and determine the gender for this one?
Well, generally you can by a certain test called the pre-implantation genetic testing. Those tests are generally used for patients who are like above age of 40 to rule out the presence of having like Down syndrome.
Right.
Okay, we can check that before we transfer the embryo into the womb.
Oh, wow.
Okay, all those patients who have like thalassemia, like they have a genetic problem in their family, where we want to rule out, ensure that the embryos are free from those diseases, and then transfer into the womb. Okay, and when we do this genetic testing, we also will know the gender of the baby before transferring to the womb.
Wow. What about the risks though? Are there any risks to say like more invasive kind of treatment like IVF where you have to inject? Is there any side effects or risk?
Yes, with any type of medical intervention,
Yeah.
there's always a side effect
Yeah.
associated with it. But thankfully, with IVF, there are not many. The commonest one is the ovarian hyperstimulation syndrome, where you have too many eggs, feel bloated, unable to breathe, you feel very uncomfortable.
Right.
Okay, but thankfully, it's only temporary. For a couple of days, then it disappears. The other one will be like bleeding and infection, but those are very, very rare. And well, the only risk that I can think of is if the IVF fails.
Yeah.
Because IVF successes depends on the age of the couple too. Okay, it can go up to about 80% to as low as only 10% in certain groups of people. So all depends on what they present with.
Yeah.
And there are a lot of interventions which are available right now to improve IVF.
Yeah.
For example, certain tests to check the womb lining to see when's the best time to put the baby in.
Yeah.
Okay, and also the genetic testing to
Right.
identify the best embryo to be transferred.
Okay. I'm curious though, are there any misconception about all these fertility treatments that you've heard before from your patients?
Yes, of course.
Tell us, what are they?
So some people feel that if they do IVF or take fertility drugs frequently, then they might become menopausal earlier.
Oh.
It's not true, okay? Because we're only going to be taking out a few eggs. Okay, so that's one. And some feel that they might get older faster. Probably that's related to becoming menopausal. It's not true. Okay, and getting cancer. Okay,
From
all these IVF and medications and all. Not true either. Unless if you already have cancerous cells in your body. Okay, and yes, of course, with hormonal manipulation, like breast cancer, for example, yes, it can grow. If you don't have it, you will not get cancer because of the medication. It won't happen. And other things will be that, will my baby be normal? Because some of them do not want to do IVF because they're afraid that the babies may have some abnormality.
Yeah.
Okay, which is not true. The abnormality comes from if the parents have a genetic issue, then yes, the baby will inherit that genetic issue too. But it's not because of IVF the baby has a problem. No, it's not true.
It's the egg and the sperm quality at the end of the day.
Yes.
Right. Oh, wow. I've actually learned so much. What about in terms of cost, a range for especially the IVF and all the test tube baby treatments?
Well, it can range between 15,000 to about 30,000
Per time?
Per time, yes. All depends on what kind of medication you use and what doses you use, whether you added the genetic testing along with it.
Yeah.
Okay, so it can be a wide variation, wide range.
So it is quite a cost there.
Correct.
So for someone who are planning, they do need to kind of like set aside that amount for them to plan and try, right? I know this question is going to sound really, I don't know how to word it, but like, what would you advise patients who have been trying and have tried everything, all of the above that you mentioned, and still to no avail? How do you manage that?
Okay, firstly, the doctor must be truthful to the patient to tell the patient their chances. Okay, now if the patient has gone through every single thing and and there are certain issues which we cannot change.
Yeah.
Like age, for example, a number of eggs, for example, or sperms which are very, very poor quality. Then the doctor will have to tell the patient, look, you have tried everything, all else fails, then talk about other things like adoption or so. First of all, we in medical fraternity have to be very truthful to the patient whether can go or cannot go.
Yeah, you can't give
I've told many patients before, I think it's time for you to stop because you have tried it, we have done it, okay? There's no stones left unturned, everything we have done. So I guess it's time for you to stop.
It must be difficult for you.
Oh yes, very difficult.
Yeah.
Very emotional for everyone, including including
yeah,
the nurse
I'm
and
curious-
all of us too.
Curious from your point of view as a doctor, to the one who has to break the news. Like, how do you prep yourself for that kind of news?
Number one, you just have to be truthful. If you stay in the part of truth, then I guess you'll be fine. So the other thing would be when all else fails, then in certain groups of patients, then we have to look at other options. Okay, called like egg donor, sperm donor, and things like that. Then we start going to those kind of discussion with the patient. If their religious beliefs or if their own beliefs they accept it, then we go into that.
I want to ask, I don't know if Malaysia is popular doing it. What do you think of surrogacy?
I was thinking about that.
Because I was watching the Kardashians and they do that because I think because of age and everything, they can't carry their own, baby. So
Is it legal?
Generally, it's illegal.
It's illegal.
Surrogacy is illegal because the lady who delivers the baby is the lawful mother of the child.
Yeah.
Okay, so you have a Chinese baby coming from an Indian lady. Well, she is the lawful mother. Okay, so
In Malaysia?
in Malaysia, yes.
Okay,
So generally, the laws are very clear. Okay, we can't do surrogacy. It's
Not in
allowed.
Malaysia.
No.
But in America, it seems to be a norm. A lot of the celebrities.
Certain countries have more liberal laws. You can do certain things over there.
Okay. So, yeah, I think those were really very insightful notes that I've been taking from Dr. Navdeep. Thank you so much for sharing. Is there anything that I didn't manage to cover but you feel like you would like to share with our listeners when it comes to infertility or fertility?
Well, I think you basically asked all the questions.
I did my job.
And even more.
even more.
I did my job. Yeah, thank you so much. And maybe could you talk to us a little bit more about TMC Fertility, what you guys do and what do you guys offer at the centers?
Well, TMC Fertility has been around for many years already. And we are one of the most foremost centers in Malaysia, or rather in this region. Okay, so we have lots of a wide array of treatment options for the patients. As I mentioned, IUI, IVF, genetic testing for the embryos. Okay, and we also have other things like support groups to help the patients psychologically and mentally through the IVF cycle. Okay, and so with all these things we have embryologists and doctors who have undergone extensive training. Okay, to ensure that we get the numbers, fertility rates high in our center. So yes, so we have all types of treatment options available.
Yeah, thanks for sharing, because I do have some facts about the center that I would love to share with you guys. So TMC Fertility is established in 1994, 2 years after I was born, okay? Not very long already. And it's really one of the first centers in Malaysia to be certified by RTAC.
Correct, RTAC,
Reproductive Technology Accreditation Committee, which is an international validation of the quality standards practice. So this means that TMC Fertility has achieved international benchmark and also is able to reassure each patient that they're providing the highest quality of care by qualified and certified medical team, just like Dr. Navdeep. I enjoyed our conversation today. He makes me feel very safe. I don't know about you.
I feel like I trust you fully too.
So you'll see me the next time I want a baby. But since you mentioned earlier that to have as many babies as possible, actually, you guys, TMC Fertility actually was awarded a Malaysian Book of Records. I think because of highest number of IVF babies from 1994 to 2013, which is a total of 3,210 babies. And by 2018, they already reached a total of 5,388 babies. That's a lot of babies.
And still growing.
And still growing because today is 2023 already. So Yeah, so if this is your first time hearing about TMC fertility, which is my first time, and if you're thinking of getting yourself checked, go check them out. Actually, I want to to get checked,
Okay.
even though I'm not planning for a baby yet. There's nothing wrong with that, right?
Yep, nothing wrong at all.
So what do I do when I go to the center? What do I tell them?
Well, generally, you want to come in for just a gynae checkup.
Right.
So when you come in there, then they'll ask you questions about any medical issues that you have,
Yeah.
about your cyst issues and all. And then we'll do ultrasound scans,
Right.
check, make sure your womb, ovaries, everything
Yeah.
functioning well. and then we'll do some blood tests.
Right.
Okay, so routine blood tests to ensure that everything's okay. And that's pretty
about
much about it.
So it's not scary at all.
Not really.
Yeah. Okay, great. To those of you who are curious, because a lot of people, the reason why I asked, and because I have an actual medical expert here to walk you guys through the process, very straightforward one, guys. Don't worry, it's not that scary.
Do you guys do pap smears there too?
Of course, yes.
Yes.
Pap smear.
Once a year, right?
Well, the actual guideline states that once in about 2 or 3 years, it's fine. Okay, you can do it once a year, it's all right, but not shorter than that.
Okay.
You don't have to do it that frequently.
Speaking of pap smear, if someone is not sexually active, do they still need to do pap smear?
Well, generally, you don't need to.
If you're not
If
sexual.
you haven't never had intercourse before. If you had intercourse even once in a long time ago,
Already break the cherry, then you have to...
then you should at least do it once in 2 or 3 years.
Right. Okay. Yeah, my first pap smear experience was very interesting. I didn't know what to expect. It was also a male doctor, which is totally fine. He made me feel safe, but like the insertion was just like, whoa! I don't know if you guys have experienced it before, but I don't want to scare you guys. But again, after the first time, it was totally fine because I kind of knew what to expect already. It's always the first time that's a little bit more scary, right?
Mine was very gentle, so I was quite cool. I didn't even know it went in, brushed, and it was done.
Yeah. Okay. We are already coming to the end of the episode, but before we do, Carice, how are you feeling about delivering soon? And after going through what you did.
I just stepped into a baby shop the other day and I was so overwhelmed. There's so many types of strollers and car seats. So I guess that's the exciting part as well. So I'm just taking like one step at a time. There will be lots and lots of advice from so many people, unsolicited ones as well. But I think at the end of the day, it's just, making sure that my baby is born first. And the prep comes after lah. Just taking it one step at a time.
You see, women have this auto download in them, The moment the baby comes out, they already know what to do.
Really?
I'm safe, guys.
I always believe that, seeing this happen in my family and all, my patients, women already know what to do. Okay, how to do certain things. Whereas the guys, they don't have the auto download switch, okay?
Have to press many times.
Have to remind, to tell them, okay? And then
The jump start.
guys are more objective. They know what to do. Okay, you tell them, okay, A, B, C, D, E, and then they'll do A, B, C, D, E. Okay, whereas women, no. I find that women they know what to do.
That's why they call it the mother instinct, right?
Yeah.
Innate.
Innate. Oh wow! I mean, I've never experienced it, but I'm so excited for you, Carice. Oh, such a wonderful moment. Yeah, we'll be celebrating. But yes, Dr. Navdeep, thank you so much. Now, since it's your first time here, at first I didn't want to ask, but you may not have heard my podcast before, but I always end our podcast with 3 questions for our special guest.
All right.
Carice has done hers in a previous
I'm a pro.
episode.
Take the questions.
Yeah, this has nothing to do with medical. You can we would love to get to know you because I'm pretty sure a lot of our listeners would be your future patient already. So they would love to get to know you. So tell us, what are you currently head over heels for?
Well, I think getting 100% success rate.
I love it. And
always striving to improve, to learn more.
okay, I love that. Good note. Second question, what's the best or worst advice that you've ever received?
Well, best advice is don't miss an opportunity
Best advice.
Best advice: don't miss an opportunity in any field. Okay, yeah.
Okay.
And the worst advice is well, not sure about that, but generally, if anybody tells you not to do something, which you deep down feel that, it's the right way to go, then I think that will be the worst advice.
That's true. Yeah. Listen to your instinct.
Listen to your instinct.
Yeah.
But you know yourself well.
I agree. Okay. And I would love to know, I just met you today, but I would love to know 3 words or 3 sentences to describe your life right now.
Okay. Happy, contented, okay, and humbled,
yes.
by the trust I've given by my patients.
Oh, I love it. I love it. I'm so sure some of our listeners are probably your patients or soon to be. But thank you once again, Dr. Navdeep. And Carice for joining us on the show. And special thanks for TMC Fertility for being part of this episode as well. I think it's such an important conversation to have, whether or not you are planning for a child or planning for family or not. I think eventually at some point, even if you don't want, people in your life, they will eventually do. And having that knowledge yourself to impart on the people around you, I think is still good to have. So with that, we'll end this episode with what I always say. Don't forget to fall head over heels for yourself first and always, and we'll see you in the next episode. Bye-bye.
Bye.